So I'm doing a tutorial on the Dyna Splint ankle dorsiflexion brace. I have an Equinus contracture about plus 8 degrees in my left ankle. I have been trying to wear it on the highest setting, which is 14, but I really probably have not been wearing it correctly. The settings go from 1 to 14 with this key right here. You turn it clockwise to increase the pressure, and I think counterclockwise to decrease the pressure. So Adam, the Dyna Splint representative, is going to show me, how to use a Dyna Splint.
All right, so foot inside here. So when you put it on, you want to make sure these cams, we call these, they're hinges, we call them cams, there's a cantilever mechanism inside, line up between the malleolus and the heel. So extend this quite a bit more here. There we go. Some of the stuff, Joe, I'm doing, you won't have to do any of this. I just want to get it. There we go. Okay. So when you get it on, but your toes, so the ball of your foot should come right to the end of the foot plate, and your toes should be kind of over the edge a little bit. First thing we want to do is your sticker on here. Shin cuff is be the first one we tighten, okay? Right now there's no tension on it. I'm going to get some on there for you when we get this on correctly. And then you're just going to work your way down. Second one is this, what we call a counterforce strap here. We want them tight. We don't want them so tight that they're cutting off circulation or anything silly, but, and I'm going to draw lines for you so you know how tight to make them. All right, now this one. This is called a butterfly strap. It's probably the most important strap on here. Because as you notice, it kind of just sucks everything up together.
Yeah.
So if this one's too loose,
I think I like it tight, actually.
yeah, it needs to be pretty snug. If it's too loose, it's not gonna fit the way we want it to. So that's about perfect right there.
So we entered from the top. Just want to reiterate.
Yeah.
One,
and I'm
two,
gonna
three.
number them for you, which should have already been done. So I apologize that it wasn't. But yep, 1, 2, and I'll put 3s on here, and I'm gonna put X's here. Anything with an X, just means you don't ever have to worry about touching it.
Okay.
So you can read it. You don't have to touch any of these ones in the back, and I'm going to put X's on them. I just want to get everything nice and snug. Where we need it to be. Put another X on there eventually. So these lines, Joe, are just so you know how tight to make these cuffs.
Okay.
If you want them a little tighter, that's fine. We just don't want them, a whole lot looser than that. These ones, you'll leave these set here. Mm-hmm. So when you take it off, you're just gonna have to undo these ones and swing it this way. Okay. So when you put it back on, just tighten these two to where it's snug.
Okay.
Because this is elastic, it's gonna give quite a bit. So if you want it a little bit tighter, that's okay. So when you put it on, foot out, foot extended, you can also do it just sitting here like this if you want to. You can put a pillow or two underneath and put it on. Doesn't necessarily matter. Once it's on, you can really sit in just about any position you want to. I would say seated or seated on your bed or laying down is best, and then just put 1 or 2 pillows underneath just so it's just up off the table a couple inches just so your heel's floating, so your heel's not making that contact. But you could have it on in the chair too, and if your foot's out in front of you on the ground, that's okay. might not be as comfortable, but it's still going to work.
Okay.
Okay? All right, let's get some tension on here. So Ryan, tension is there. I mean, there's only one place you could put this hollow end right here. This tensioning tool is milled to fit perfectly inside. And what we're looking for.
Can you go to 14, or that's not possible?
Well, so it really only goes to 12,
12
actually.
Okay.
But I don't want to if we don't have to, and chances are we shouldn't have to when it's fit correctly. So it's foot-pounds of force, goes from 0 to 12, numbered every third line. So like 0 is numbered, 3 is numbered, 6, 9, 12. So technically it kind of goes to 13, but it's numbered to 12. It's kind of like a tape measure ruler. It's numbered every third line, but every line does represent one increment of tension. Okay. And then you line it up with these scored lines on the side. That's how you know your tension's set. Same thing on each side. So let's go to, we're going to go to a 6 on each side. And just, if we need to do more, we'll do more.
Okay.
I just want to see what it does for us. So the hardest thing sometimes with this, Ryan, is you know, when patients get a stretch with their therapist, it's that high intensity, short duration stretch, right? Dyna Splint is a low load, prolonged stretch, so it's supposed to be very, very, very mild. What I always tell everyone, Joe, is 0 to 10, 10 being the most intense stretch you can imagine.
Yeah.
We want you to feel a 1 or a 2 on that scale, because it's the time that gets the job done, not the tension necessarily.
Okay.
Do you have good sensation?
I do have good sensation.
Good, okay.
Yeah.
And what I do is I reach back here and feel if the Achilles is tight, which it is. It is a little tight. Do you feel it stretching you?
Not really. I think I need a lot more.
Well, we don't. I mean, it's tight back here.
Okay.
I'd rather leave it at 6, and have you do. You know, if you want to do 3 hours at a time, do 3 hours at a time. Because, like I said, the time is the important part. If we turn this tension up too much, what ends up happening is you have something called muscle spindles in here.
Yeah.
And there's other things too, and it fights against that stretch. It tries to protect itself because the body feels like, oh, that's a lot. So the muscles try and pull back the other way to prevent that stretch because they're afraid it's gonna cause damage.
Yeah.
That's just the way we're made. So what ends up happening is those muscles, the agonist and the antagonist, two different muscle groups are working against each other, and you end up with some inflammation and some soreness and not really a good stretch. So I'd rather, I felt it before I turned the tension up and it wasn't tight at all. It's tight now, even up into your gastroc right here where the insertion is.
Look, because you see, I can dorsiflex. That's why I don't think it's tight enough.
That's a common misconception too. You may be able to bring your foot back more than this is taking you.
Yeah.
That doesn't mean it's not stretching you though. Because like, for example, like I can feel a stretch in my hamstrings right here. I can go further, right? But I want to stop where I start to feel it. So, this is not, and that is a really hard thing for a lot of people to understand, I think, because, in our head, you want to see like, oh my gosh, I can pull it all the way up here, and this isn't taking me that far, so I should turn it up more. It's not necessarily about how much it's pushing you into dorsiflexion. You're going to get more dorsiflexion as a result of it, but all we're trying to do is take you right to where you feel a stretch, and that's it.
Okay.
So even though that you can pull it back more, that's not what we're looking for, because the way this works from a physiological or a biomechanical standpoint is that connective tissue is like this, right? We just want to take it to its end range as far as it wants to comfortably go and hold it there. So the best way I can explain it is if you take a rubber band and you pull that rubber band as hard as you can, where it's almost about to snap, and you hold it for 20, 30 seconds. When you let go, if it doesn't snap, it's going to go right back to where it was, right?
Yeah.
If you take that rubber band and you pull it just a little bit to where it stretches, right, but it can go way farther, or we just take it here, maybe put it around a softball and leave it there for a few hours. After you do that a few times, when you take it off, it's going to stay right where you left it. And then you're going to put over something bigger and bigger and bigger. So it's the time that's getting that done. If you put that around that softball and take it off in 30 seconds, you're going to be right back where you started. So you're going to want to turn this up tomorrow or tonight or in 2 days, but give it some time, okay? What I would suggest, if you feel down here with your finger, you feel how tight this is right here, every time you put it on, just feel down there with your hand like, okay, wow, that's tight. When you start to notice that that tightness is going away, it's not as taut back here, it's a little more loose, that's when it's time to turn it up.
Okay.
So I would say at the soonest, turn this up in about 10 days, 7 to 10 days.
Okay.
So
I already, well, I mean, I probably wasn't wearing it right, but you know, I was wearing it though for.
well, in your defense, I
Yeah.
don't think it was instructed to you very well, and that's that. How are you supposed to do it right if you're not shown how to do it
Yeah.
correctly? So that's on us. That is not on you.
Okay.
But I think if you humor me for a few weeks,
Okay.
you're gonna be really surprised at how quickly this starts to work. And if you feel like I'm not getting enough of a stretch, do more time for the first 7 to 10 days, and then turn it up. Okay.
Okay.
I think I really think you're gonna be surprised, and within 30 minutes or so, you're probably gonna be like, oh, okay, now I see what Adam's saying. I feel it a little bit now. Just want to feel it a little bit though. That just a little. You know, I could sit here, I could take you and push you way up, right? And you'll be like, oh yeah, I really feel that. But you won't be able to. You won't be able to allow me to hold you in that position for very long, because it'll start to get uncomfortable. That's where the low load prolonged stretch comes in and is extremely effective, because that length of time. You can also look at it as braces on your teeth, right?
Yeah.
You get your braces on, takes time, things move into place, then you go back and you see your orthodontist, like, okay, we got to make some adjustments, and they tighten them up or whatever they do, and it's a process. And that's what's hard, because we want it to happen quicker, you know, and most of the time, if you work harder, things happen quicker, but in this case, you need the time, as much as we don't necessarily like that.
Okay.
So what we're gonna do is we're gonna take it off, and we're gonna go over putting it on with the tension on, because process is the same, but it's just change things just a little bit. I always recommend putting the Velcro back down on itself when you undo it or when it's not on, just so otherwise the Velcro all sticks together and it's a big giant mess. All right, so you're gonna notice when I take this out, just like it was before, it wants to push up, right?
Yeah.
It wants to pull you up. So what you do, lay it out, foot inside, and then foot right where you put it, and then you want to push your foot down and then pull up here. So that way it gets those cams where we want them.
Okay.
Go ahead.
You said the cams again should be lined up with what again?
So they don't need to be perfect. What we don't want, and I'm going to fix it in a minute. See, right now your heel's touching and the cams are touching.
Yeah.
That's fine, but you don't want the cams to drop down below the heel. So the cam should be kind of right where my finger is, and as soon as I attach this butterfly strap, that's where they're going to end up.
Between the heel and the medial malleolus.
You got it.
Okay.
All right, so slides between the wing pad and the strut. These are called wing pads, Ryan, just so you know. And the reason we put the lines is so they know how tight to make them.
Right.
I always just get them started a little bit, and then we're gonna pull them at the same time. So you notice how much those cams came up once the cam was much lower, and now they sucked up a bunch.
Okay.
Because we tightened it up.
Okay.
That's all there is to it.
Okay. Thanks for watching this video.